a new warning from Dr. Fauci in regards to how quickly vaccines might be moving forward. And he warned Reuters in a conversation with Reuters about pushing a vaccine out too quickly could jeopardize trials and researching other candidates out there. Of course, we've seen reports that President Trump and the administration there and the FDA might be favoring AstraZeneca's candidate there with researchers at the University of Oxford. We'll see what happens. But another warning from Dr. Fauci saying that things might be moving too quickly. We've already seen that in another aspect of blood plasma being greenlit there for emergency use authorization. And for more on all of those things, we're joined by one of our favorite experts on the topic. Dr. Michael Saag is Associate Dean for Global Health at the University of Alabama at Birmingham. And Dr. Saag, it's good to be chatting with you again. I want to start on Dr. Fauci's warning here, because obviously from the convalescent plasma warnings that we heard from the FDA, which we can get into in a second, a lot of people might be worried we might be moving too quickly. What's your take on his warning there to slow things down?
I couldn't agree with him more, Zach. It's just like Diana Ross and the Supremes. You can't hurry love and you can't hurry vaccine development. The reason that I say that is that we need the time to see, A, if the vaccine actually works, and we need to see if it's safe. What we don't want to do is rush things along so fast for obviously political reasons, as far as I can tell, to get it out there and then discover, wait, this vaccine doesn't work like we thought it was going to work, or worse, that there's safety issues. So Fauci is exactly right. We need to do this the right way and keep a firewall between science and politics.
And that's kind of the worrying thing, because now we're hearing it from both sides. Of course, the president has been critical of the FDA, perhaps moving too slow. He's claimed that that's because potential deep state factors at the FDA to influence the election. On the flip side, you have Democrats worried that the president might be pressing to get a vaccine approved regardless of the health concerns. I just want to read what we did get from the FDA commissioner, Dr. Stephen Hahn, I guess acknowledging some of the faults that he made in moving quickly with the blood plasma and citing the scientific data that experts, even on our show yesterday, had raised issue with. I just want to read what he said. He said, quote, "I've been criticized for remarks I made Sunday night about the benefits of convalescent plasma. The criticism is entirely justified. What I should have said better is that the data show a relative risk reduction, not an absolute risk reduction." What's your take on maybe that mea culpa there when we talk about moving too quickly and making sure that the data does show support for moving and approving some of these things to get, I guess, options out there for patients battling coronavirus?
So the data where these studies were done came from the Mayo Clinic, and there was 35,000 or so patient experiences. And even the Mayo Clinic itself said this is not robust enough, in their opinion, for early use authorization. And Dr. Hahn on Saturday issued a notice that said, yep, we agree. And then on Sunday, total reversal. And a press conference was urgently held, and he was brought out in front of the podium and said, in essence, that there's a 35% benefit, which was he's incorrect. Everyone chastised him for it. But here's the problem. We need to let the FDA do what it does. We need to let the NIH do what it does. We can't really have politics interfering with what science needs to do. It's not going to work well. And it's going to endanger all of us if we keep letting this bleeding happen from the political space into the science space. So let's let everyone do their job and try to keep politics out of it. That would be my advice.
Well, let's talk more about some of those, I guess, data-driven takes here, because, of course, the evidence that you're citing there from the FDA for the emergency use authorization on plasma was not exactly the gold standard in terms of randomized control trials. But we did get an update today from a study looking into Gilead's remdesivir, of course, one of those treatments that has been shown to be effective in maybe reducing the hospitalization times for some of the patients battling this. But the new study there, I guess, brought into question some of those benefits, saying that the importance of the findings here in this study is uncertain. People have said that a shorter treatment of Gilead's remdesivir has been shown to be more effective, but it's one of those rare treatments that we've seen doctors turning to maybe at least boost some of the outcomes in some of the most severely affected patients. What's your take on that, and how, I guess, we're still limited in how many treatments are out there that have been proven effective for treatment in patients right now?
Right. The thing we have to keep in mind, Zach, is that we're so early into this epidemic, and treatments, unfortunately, are going to be slow to develop. For remdesivir, we knew even when the original results came out that it didn't have a statistically significant mortality benefit, and it seemed to work best in that sliver of patients that are in the hospital before they go to the ICU. And so that's where it has its best efficacy. If you wait until somebody's in the unit on a ventilator, it doesn't seem to work as well. To me, the best drug we have so far is an older drug called dexamethasone. It's a steroid, and we're using kind of both dexamethasone and remdesivir together until we can get other drugs available to us.
And again, until we get a vaccine that's approved as well, that being another form factor of defense, I guess, here in the pandemic. But until we get that approved, whether it comes too quickly or not, depending on which side you sit on, there was a report out of Hong Kong that a patient documented to have gotten COVID-19 twice. We asked our doctor on the show yesterday about what that says about vaccine efforts and how that might throw a wrench into the idea that the vaccine will be the end-all be-all in this battle. How worrying is that you do have a patient who had tested positive twice, and what does it say about the efficacy of the vaccine and that being the defense that we need to really get this pandemic under control?
Yeah, anecdotally at our site, we've seen about 6 or 7 cases that we strongly believe had a second round. So I'm not surprised about the Hong Kong situation. The reason that made news is that they actually had genetic evidence that it was another virus species. So nailed it. And it's not surprising to me. Other coronaviruses we can get reinfected with. So what does it mean? Basically, 2 things. One, if you've had the virus before, like me, I had it back in March, I could get it again. So I'm protecting myself just like everybody else. I'm not going to get arrogant and say I've got some shield that protects me. The second thing does relate to vaccines. And in that regard, what I think it means is that we're going to have to be, if we find a vaccine that works, we're going to have to be dosing it rather frequently, maybe as often as every 4 to 6 months. We don't know yet. And for those people like me who've had it before, we probably ought to get in line for the vaccine too. And maybe we find the correlates of immunity to be antibody, hope so. That way we can track it and know when it's time to give the next dose.
Yeah, no, a definite good reminder there for people who might have thought they would have been out of the woods if they already got it. My little brother falls in that same camp you do. And now I guess credit to my mom for constantly staying worried. Since you're never too safe, mama's going to worry out there. But one last question for you, Dr. Saag, before we let you go, pertaining to your community close to home here. When we got the update about cases at the University of Alabama. And of course, there's multiple campuses, but at the main campus in Tuscaloosa, more than 530 total cases there, and just kind of speaks to the concerns that we've seen out of a lot of college campuses. Of course, University of North Carolina, Chapel Hill being the first there to kind of pull the plug on on-campus teaching. Even the president there at your university kind of claiming that it's problematic seeing that. All in all, still a 1.2% positivity rate. I guess not extremely worrying when you think about New York's hovering around 1% too. But what does it say about concerns right now of letting students back on campus, what it might mean for, dare I say, football prospects of getting those games played at the University of Alabama? What's your take on the issue at hand now?
Got 3 things quickly. One is that this virus is very contagious, and I suspect most every campus in the United States is going to be affected by this. I'm not going to point my finger at the students. Being in college is a fun time of life, and you're going to have social interactions. We're asking the students, though, to be responsible and wear masks, especially in social situations. Hard to do, hard to implement. Second thing about football, I think exactly the football players on most of these teams are perhaps the most protected because they're typically maybe not going to classes directly. They're being held in a bubble of sorts on the campus. They're being tested 3 times a week. So I think they're going to be okay in the games that we played. Whether there'll be fans in the stands, now that's a whole nother question. Here's where I'm concerned, and I'll leave you with this. If this is happening on college campuses to this degree this quickly, what's happening through K through 12 right now? Because we're not testing there. And what I'm concerned about, we have high school football, we have high school other sports, we've got people having social interactions. I'm worried that the gains that you alluded to earlier in terms of reduction in cases could U-turn right back by October 1st. If we need to start mitigating into the K through 12 situation, know what's going on. And right now we don't have a clue, but my sense is it's kind of bad.
No, it's a very good point. And as we talk about, as frequently bashed as college students might be for their behavior through all this, I mean, you got younger kids as well who it's just hard to put masks on and get them to wear it. But we'll see what happens with all that. Dr. Saag, always love having you on the show. So thanks again for taking the time, and good luck.
Thanks, Zach. Good being with you.
Hey investors, Zack Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.